Good afternoon. I'm Dr. Bonnie Henry, the Provincial Health Officer here in British Columbia, and today is our update on the COVID-19 response here in our province. I want to start by acknowledging that we are on the traditional and unceded territories of the Lekwungen-speaking peoples, particularly the Sanghees and Esquimalt First Nations, and are very grateful for these traditional keepers of this land, and we look to them to support us in doing our work in a good way. To start with our case updates, we have 42 new cases who have tested positive today, for a total of 659 in British Columbia right now. By health authority, that is 339 in Vancouver Coastal Health, 218 in Fraser Health, 47 on Vancouver Island, 46 in Interior Health Authority, and 9 in the Northern Health Authority. We have one additional long-term care home in the Vancouver Coastal Health region where one healthcare worker has been detected with COVID-19, and that is the Broadway Pentecostal Lodge in Vancouver. In terms of the long-term care homes, we have no additional cases today at the Lynn Valley Care Centre, though unfortunately we do have one additional death from that outbreak. Hollyburn and Deltaview, the German-Canadian House, Dufferin Care Centre, Little Mountain Long-Term Care, and Evergreen Heights, which we've reported on, have had no change in the number of residents or staff affected at this point. But there has been an increase at Harrow Park, where we now have 28 residents and 27 staff who have been affected by COVID-19. Currently, there are 64 people hospitalized in British Columbia, and of those, 26 are in intensive care unit today. On the positive side, we now have 183 people who have fully recovered from COVID-19 in BC. As mentioned yesterday, the coroner's office is investigating the death of a dentist to determine if this death was related to COVID-19. And I want to express, again, my condolences and my thoughts to his family, who I know are have been extremely affected by this, and it has been a very challenging few days for them. I want to say that the coroner's investigation is ongoing, and I do not have any further details to report at this point. So we have, as we know, yesterday I was also asked for information on healthcare workers specifically, and whether we had a breakdown of healthcare workers who have been affected by this. And looking right now, I do not have the exact numbers of healthcare workers, unless they're related to the clusters, particularly the clusters in long-term care or in hospital that we've had. So we have those 9 long-term care facility outbreaks, and we've had the 1 hospital. And of those, we have 55 healthcare workers who are affected from those outbreaks. For most of the other healthcare workers who have been involved in these, who have tested positive, their exposures have been more in the community, and so they have not been identified. For example, the number of dentists that we've had are also healthcare workers, but their exposures have not been in the workplace. But we do, I mean, it does draw attention again to the fragility of our long-term care facilities and the risk that we put the residents of long-term care, and that is why we have put on some very strong measures, not only for the facilities where there have been outbreaks, but doing everything we can to try and protect our elders and seniors in those long-term care homes around the province. And I talked yesterday about the order that we're developing that will help ensure that healthcare workers are able to work at one facility only, particularly during this critical time, to best protect our elders and seniors in these facilities. As well, there are additional measures in the outbreak facilities around personal protective equipment, restriction of visitors, and restriction of visitors in all of our long-term care homes across the province. And I know this is incredibly challenging, particularly when it's our loved one who's in one of these facilities. And I know staff are going out of their way to try to find ways to keep you connected with your loved ones, and we will continue to do that. We have been, as you know, we've talked about this many times, actively monitoring our supplies of personal protective equipment, recognizing that the protection of our healthcare workers and our healthcare systems is of paramount importance in this outbreak. In the past week, we have seen a dramatic increase in use as we've had more people with COVID-19 in hospital, and we understand the absolute need to keep people safe. But the burn rate, as we call it, is much higher than we would have expected, and we are putting in place measures now to try and control that and be more efficient and effective in how we're using PPE. We have new shipments on order. We're looking at things like alternative supplies across the board, alternative ways of preserving personal protective equipment, so it is available both now and in the future. And we're at a bit of a critical phase with personal protective equipment. This happened quite quickly. We have had a number of supplies on order for some time. Some have arrived, thankfully, and we are actively looking at how we can get as much as we can in the short term. But we are looking at alternative supplies and ways of managing to be more efficient in PPE, and more of that will come out over the next coming days. Finally, I did want to talk about public gatherings, which is something that we've talked about a little bit over the last couple of weeks. And as people are aware, I have given an order prohibiting gatherings larger than 50 people. And we talk about 50 people, and initially there's no science behind that. It's around what's been done in other places, what's sort of a manageable, reasonable number of people where you can maintain distance with that number of people. But this is not an order of convenience. This is something that is required to protect people, and we know that 50 is not an absolute number. It is the maximum, but we know smaller is better. And we really, at this point in time, particularly in the next 2 weeks, as we're trying to delay the onset, prevent the transmission of this virus, we need to continue to not meet in groups, even groups of 10, even groups of 20, small groups, even 2 or 3 can sometimes be that transmission point. So we're not talking about workplaces and areas where people live, where you can put in place measures to try and increase separation. But we're talking about gatherings, about having people over to your home, about gathering together in the park. These are things that right now we can't be doing. We need to connect virtually. We need to have a safe space between us for the next little while. And that includes celebrations and ceremonies. I recognize when we're in a crisis, when communities are in crises, having celebrations, having ceremonies is our way of helping to cope, helping to understand what's going on with these critical times. But they are also times when we may expose those who are most vulnerable in our community, our elders, our seniors, people who are more at risk because of their underlying medical conditions. And I'm asking you right now, the leaders in our community, our faith leaders, our spiritual leaders, our community leaders, that we need to come together virtually to protect those in our communities over the coming weeks. And that means that we need to find alternate ways of coming together and sharing the information, the support, the connectivity that we have as a community without being physically together. So again, it's talking about physical distance and social connection. It is very important right now that we come together in our communities and support each other, but we do that in a virtual way, and we have a safe space between us to stop the transmission of this virus. So I've said it many, many times. There are things that we do to support ourselves in this community, and we have to be kind, we have to be calm, and we have to continue to be safe. Thank you. I'm happy to take questions.
Okay, we will move to the question segment now. As a reminder to everybody on the phone, please limit your questions to one question. You press *1 to enter the queue, and please unmute your phone. You will not be audible until you are patched through, so take your phone off mute. Our first question comes from Mike Howell with the Vancouver Courier. Go ahead, Mike.
Good afternoon, Dr. Henry. I'm wondering, how did the infection rate at the Harrow Park Centre in Vancouver increase from 1 case reported March 18th to 55, I believe, today? And are any of those cases connected to other long-term care facilities?
Yeah, so the initial cases at Harrow Park were a resident and staff, and then it became apparent over the next few days that others had been exposed to those people. So it is not surprising to us that we're seeing an increased number of people being affected by this. None of the people are in hospital. All of the residents and staff are either at home or continuing to be at Harrow Park. But as we saw, once you've been exposed, we have no way of protecting you from getting sick. So over the period of the incubation period, we've started to see more staff and more residents become ill. What's really important is the outbreak measures that are being taken in Harrow Park to prevent all of those people who had been exposed before and were now developing illness, making sure that they are isolated as they develop their illness so they're not passing it on to others. And that's been the focus of the outbreak response. Unfortunately, we know that this has quite a long incubation period, so those who had been exposed before the first cases were recognized are the ones that are now developing illness.
Okay, next question, Ethan Sawyer, CBC.
Hi, Dr. Henry. My question pertains to testing. CBC is hearing from many people who don't know where they got the virus but still aren't being tested. Just wondering if you can clarify the current testing strategy. Is the current strategy to test everyone whose infection source can't be traced?
Well, not everyone. So it depends a little bit on the community, on what the public health people know about that. And we are focusing on where it makes the most difference and the most difference in protecting the healthcare system. So as you know, we are focusing on healthcare workers. We're focusing on the health system, so people in long-term care or people who are in hospital or likely to be in hospital. So for the most part, if you have a mild illness and it can be managed at home and you're in isolation and you're not going to pass it on to others, you may or may not be tested, depending on whether there's a cluster that's detected around you in particular.
Okay, next question comes from Mary Griffin at Check News.
Oh, hi, Dr. Henry. I'm just wondering, what is your take on the new cases? It seems to be steady after that big jump that we had a while back. And I know these are typically, the new cases are, I say older, but also, are you pleased with that trajectory, and what does that tell you for the next couple of weeks?
I'm certainly not pleased with any trajectory that's above zero, but I think the reality is this reflects what has happened, as I say, over the last 14 days. So what we're seeing today in people who are testing positive are people who have been exposed to this virus 10 days to 14 days ago, or 2 to 14 days ago. So I do want to see that coming down. I do want to see it dramatically decreasing. We have talked about the backlog, and so now the last couple of days we've had quite high numbers, and the backlog of tests has run through. So these are much more timely tests. Having said that, there's a period of time, of course, between when somebody starts having symptoms and when they get the test and when the test comes back. So again, this still reflects onset of illness from several days ago. So our whole purpose in the testing strategy is to try and ensure that we're catching people before they're able to pass it on to others, which is why that message about even if you have any symptoms, even if you have what you think is just a bit of a cold, you need to stay away from others and then determine whether it's getting worse, whether there's a risk for COVID-19, and whether you need to be tested or whether you need to just stay home until you're better, until you're no longer infectious to others. So it's a bit of a dance right now with all of the measures that we have in place in the community, plus our testing strategy. What I want to see is these numbers starting to come down over the next coming days. And particularly when we look at our epidemic curve, we want to see that the onset of illness of people, the new cases starting, is going down. And we actually won't know that for a few days. So it's a difficult position to be in, because all of the measures that we're doing in our community, some of them are very dramatic measures, draconian measures even, that we've had about social distancing, about physical distancing, stopping working, stopping people getting together, having those connections. We are not going to see the impact of that and be able to measure it until next week. So I am hopeful, and I'm hopeful that we're not seeing dramatic increases in numbers, but we are still in the waiting and watching phase.
And next up is Ashley Legasic from CFJC. Go ahead, Ashley.
Hi, Dr. Henry. For the Interior Health Region, is there a number breakdown for how many cases are believed to be travel-related as opposed to community transmission-related? And do you have an estimate of how many COVID-19 cases there actually are in the province, as opposed to just the number of confirmed cases?
Yeah, so I don't actually have that breakdown off the top of my head for Interior Health. Early on, and for Interior as for everywhere else, but early on, most of them were imported cases. I know there has been some local transmission in Interior Health, but I'm not sure of the proportion. But we can look at that. We can look at it overall as well. As you've seen nationally, the proportion of community spread cases has increased as across the country. Travel-related ones have decreased, with travel being restricted, but we're now seeing that there is transmission in communities. And so these are why we're putting in these broader community measures. In terms of how many cases we actually have based on what's happened other places and modeling and things, I do have an estimate in my head, but that's not a very stable estimate, if you will. It changes day by day, and we are going to be talking, I believe it's Friday morning now, in some detail about the modeling that gives us those estimates. So I would prefer, if it's okay with you, to put it off till then so we can put the whole context around it, and I can give you some visuals about why we think it is where it is.
Great. Next we have Jeff Andreas from Radio NL. Go ahead.
Hi, Dr. Henry. I'm just curious, what types of information are, basically being required to be put out by local health authorities? Like, when it comes to individual cases or even, possible contact at events, I know we had like a case in Sun Peaks here over the weekend where the community felt the need to put that info out, that there was a positive case in Sun Peaks. Is that something that should be coming from communities, or is that something that the health authorities should be letting us know about?
Yeah, so the health authorities will let you know when there's a risk to the public that we can't identify the individuals who were at risk. So, for example, in Victoria, the health authority put out a notice that there was somebody who was symptomatic who had attended certain businesses here in Victoria, with a warning to people that even though the risk was low, that if they develop symptoms, it might be related to that. We've done that for the dental conference. We've done that for some community exposures where we're not able to identify everybody who was there. The Sun Peaks one, I understand it was that individual who felt that he wanted to go public with his diagnosis, and the fact that he had warned a lot of people about this and had connected individually with people. So I think that's perfectly valid. If individuals want to talk publicly about their own experience, that's up to them. But for us, it's in public health, it's ensuring that we put any risk out there in the public that people need to know about, and then we protect as much as possible people's privacy. So it's finding that balance.
Great, thank you. And our next question is Moira Warburton from Reuters. Go ahead, Moira. Okay, we'll move on to Marcella Bernardo from News 1130.
Hi, Dr. Henry. I was hoping to ask you about the downtown Eastside, because we now have information that someone who has COVID-19 is now in that neighborhood. So could someone please clarify what's being done to keep others in that area safe, namely frontline health workers and volunteers interacting with these people daily?
Yeah, so my concern about the downtown east side is the workers, of course, but also the people who are living in those in the areas in the downtown east side in particular are people who often have other underlying health conditions. So our work with Vancouver Coastal, with the City of Vancouver, the strategies that we have in place with a number of the agencies. So there is a very specific working group that is developing, that has developed plans for how we would support and manage issues in the downtown east side. And really it is protection of the people who are living there who may be more vulnerable to having severe illness or from COVID-19 that we're focusing on. There are plans in place for how to help people isolate should they become ill. There's places that are available to house people and care for them should they become ill.
Next question comes from Jane Side from the North Shore News.
Hi, Dr. Henry. I'm hoping that you can clarify a little bit around this possible death connected to the dental conference. You've said that the coroner is investigating. I haven't heard that in terms of any of the other deaths that you have announced so far in relation to coronavirus. So I'm just wondering, like, what makes this particular death different in terms of how you're investigating or treating that as opposed to some of the others that have been previously announced?
Well, I think that's exactly the point. The coroner is investigating a sudden, unexpected death in the community. We don't know if it was related to coronavirus or not, and that is what of that is why the coroner is investigating this. So I have not said that it is a COVID-19 related death. We need to understand the circumstances of the death, and that's the role of the coroner.
Next question, Keith Baldry from Global News. Okay, next, David Molko, CTV.
Hi there, Dr. Henry, just following up on the North Shore dentist as well. You said yesterday your advice to patients, people can be reassured that if you saw your dentist and they were fine and there was nothing wrong with them and they had no symptoms at that time, that you're not at risk. Those were your words yesterday. And my question to you is, you sounded pretty confident. How can you be so sure given some people never show symptoms at all?
Yes, and we also know that some people who never show symptoms, their chances of passing it on to others is extremely low as well. So we know the most efficient transmission is when people are sick. So the whole question of asymptomatic transmission, we also know that the people that we have been in contact with who had symptoms, the people that they had contact with when they were at risk are either have been or are being contacted by public health. So if you have not been contacted by public health, then you're not somebody who saw that person when they were symptomatic. We also know that the most transmission happens with close contact on a regular basis. So often it is staff and people working in the environment that are more at risk as well. So it is a challenge. There's obviously it's not zero risk, but if you were in the office days before this person developed symptoms, then we don't have any evidence that shows that you're at risk for this.
Next, Nick Johansson, Castanet. Go ahead, Nick.
Hi, Dr. Henry. I was just looking to get some clarity on the criteria the ministry is using for disclosing locations where outbreaks of COVID has occurred. And would a place like a subsidized senior housing development fall under that criteria?
Yeah, it's criteria that are used by the health authorities, by public health, where we declare an outbreak. So if it is in a setting like a shelter, for example, a housing community, something like that, where we have outbreak measures that are taking place, then we will declare it an outbreak. We actually have a protocol that we've been using for many years around long-term care in particular, where those are posted, and around acute care facilities. So you will have seen them on health authority website over the years of influenza-like illness or gastrointestinal, so stomach illness outbreaks. We've had outbreaks of other diseases as well, and there's a transparent process for posting when those are happening. So we're using the same criteria for this as well.
Next question comes from Megan Turcato at Global. Go ahead.
Hi, we've had a notification here at a fairly large Vernon High School that students and staff might have been exposed. The notification went out in the last couple of days, and the isolation period was meant to end today. That would be the 14 days. And so I'm wondering if you have any thoughts on what this case, with people being notified right at the end of this proposed or required isolation period, what this says about our ability to notify people about potential exposures and to contain it, and whether you know if this case at Clarence Fulton High School is going to be treated as a potential cluster, and if other people with symptoms are going to be tested.
So I guess there's a couple of questions in there. So I'm not aware of the exact circumstances of that exposure, and it would depend on what the notification was about. So there are different levels of risk when somebody has been exposed. When we find somebody who has this disease and we find their close contacts, we do that contact tracing, and we find anybody who is around them and who we know have the highest risk, and we isolate them during the incubation period. Sometimes, and this has happened in a number of occasions where somebody has traveled, we've had people come back from a cruise, for example, and we didn't realize that they had been exposed till quite late in the incubation period, and so in their contacts in incubation period. So they might have been sick for many days, walking around doing things and having close contacts. So the best that we can do is advise people to self-monitor for that period of time, and if they have developed symptoms during that period of time, to connect with us. So all of these ones where somebody was advised that you needed to monitor for a period of time means that we've done a cluster investigation of that individual and realize that others may have been at risk. But the risk is not the same for everybody. It depends on the type of contact you might have had. So even if we say, for example, here in Victoria, if you had been at this establishment on this day, you might be at risk. But we can determine when we talk to the individual whether they were actually anywhere near the person or not. So we may not put out all the details of the investigation that we have in each case, and that allows us to help individualize people's risks when we connect with them. The dental conference is a good one. We didn't recognize that there were a number of people who became sick related to that conference until we were at, I think, day 7, day 8, or maybe it was even day 10. So we were asking people to self-isolate for the following 5 or 6 days, and more cases. So it's a little bit of a combination of isolating those who had not yet become sick and case finding, or finding the people that were out there that were sick, and then trying to stop their next generation of contacts. So it is a challenging thing. It's incredibly challenging, and we talk about, that's where testing helps us. That's where contact tracing, basic public health work is really, really important. And we look at what they've done in Hong Kong, in Taiwan, in Singapore. That's the basis of it. We have our firewall that we're trying to have with everybody keeping their distance, and then we're doing the contact tracing of individuals within that firewall to try and put out the sparks and the flames as they arise. And it's challenging because we don't always find people in time, and that means that others have been exposed, and so we're now catching up to the next generation. But that's how we do this, and over time we'll be able to, we don't have as many people coming in from other countries, so that helps take those sparks away, and we're now being able to focus on protecting the healthcare system and trying to find those sparks in the community as well.
Cassidy Olivier, Vancouver Sun.
Oh, hi, Doctor. Just a quick question on the hospitalization intensive care numbers. They're slowly creeping up over the last week. Just curious on how we're supposed to interpret these numbers and what they say about how the virus is spreading, and what happens if we keep on this trajectory. And also just curious about an age breakdown of these specific groups that are being noted in here.
Right. So the age breakdown, I presented that on the weekend, and it is up on the BC CDC website on a daily basis. For the most part, we have sort of two groups of people. Most of the people who are hospitalized and in intensive care are older or have underlying medical conditions. But we also have a group of healthcare workers mostly who are younger, in their 30s and 40s, who have very mild illness. So we have a bit of a difference in those, and that is reflected in the data. I will present some more of that when we talk about the modeling and why we're looking at this. Obviously, it's people in hospital and people in ICU that we're watching very, very carefully, because those are hard numbers. You know, in the community, as we talk about, we're focusing our strategy, our testing strategy right now to try and find those sparks. But we know that the increasing numbers in hospital reflect that and reflect what's going on in our community. So it is something we're watching very, very carefully, and it's the reason why we've taken all of those measures to decant our hospitals, to have both the people, the beds, and the services available as this number will grow. And it will grow. We know right now that we're still a generation behind in cases. There's people that have been exposed before we put in these measures, who will start and will continue to start to develop disease over the coming week to 10 days. And so that's why we're in this period where we're watching very carefully. It's heartening to me, though, that we're not seeing dramatic increases and doubling in a day or 2 days or 3 days of the hospitalized cases. It is gradually increasing, though, and we're watching that very carefully.
Next question, Richard Zisman, go ahead.
Hi, Dr. Henry. I understand there's a confirmed case at a construction site at the Vancouver International Airport. Considering that, I wonder if that means there needs to be stricter measures around construction sites or closer guidance around construction sites. And on another sort of similar issue you've dealt with, on the downtown east side, there's also been a number of complaints around social distancing issues. And I know Marcella asked about this, but more specifically, does more need to be done on the downtown east side to move people out of that community to ensure that they are forced to socially distance?
Yeah, so, you know, I don't know the circumstances of somebody at a construction site, whether that person was exposed at work or exposed in their home environment, and that is what the public health investigation will look into. I absolutely think there needs to be measures at all of the workplaces that are continuing to function, to keep us going, all of the essential services, some of the construction work, to make sure that we have the best measures in place to protect everybody on that site. And I know WorkSafe is working on those, that we have measures that have been enacted in many of those, or most of those places. So, you know, that is a work in progress. Construction sites are not as higher risk environment, as we know, because they're mostly outdoors. So there's ways of mitigating risk in those sites. In terms of the downtown east side, you know, again, like here in Victoria, like in other communities, this is the home for many people. So we shouldn't be thinking about forcing self-isolation in people in their homes. What we need to think about is, what do we need to do to protect the people in that community, both the people who are working in that community, the people who are living in that community, the people who are coming in and out of that community, to make sure that we're not introducing this virus into a very, in many cases, a very susceptible population, to people who might have very severe disease with this, making sure we're supporting them and getting their health and medical needs supported, which is always a challenge for many people, and doing the best that we can to keep this virus out of that environment. And that does mean enhanced cleaning. It means finding ways to give people their own space that's safe and away from others. But these are not simple problems, and you know, they can't be just forced upon people. We have to do it in a way that respects people and that protects as many people as possible.
All right, next up is Les Lane from the Times Colonist. Go ahead, Les.
Oh, thank you. Minister Dixon, yourself have been stressing the need for 100% compliance. And I was wondering, is it kind of an all or nothing approach with this? Does social distancing work on anything less than 100% or pretty close to it, given the transmissibility?
Yeah, so if we look around the world at how people have done this and what has worked, I think we need to find that sweet spot where we're still able to get food, to get medicines, to carry on the important functions of our days and our lives, but also maintain that distance, that space between people. So it can never be 100% in that not everything can shut down in our society. But we need 100% of people to do their bit, which means making those sacrifices both as an individual, as a family, and as a community. And I've talked about some of the important sacrifices that we make about things that comfort us in a time of stress, like the ceremonies, like the celebrations, the rituals that we have as a community that bring us together. Right now, we all have to take a step back and look at how we can support each other virtually, how we can maintain our connections, our support of our community without having that physical closeness. And we need to do that now. And all of us need to be conscious about that in all of our communities, because it is protecting our own families, our communities, and across British Columbia. So that's where we're talking about 100%. We all need to understand where the risks are and how we can be part of this to keep that firewall up there for us.
Next question is from Keith Baldry. Go ahead, Keith.
Hi, Dr. Henry. I wonder if you could expand on your comments and concerns about the personal protection equipment issue. How acute is a potential shortage? And the minister has talked about, well, he's announced he's vacated 3,800 beds, and we're getting, I understand, a scenario on Friday. Will we be in a situation where we will have enough of this equipment to meet with what some of these scenarios could be?
Yeah, that's our wicked problem. You know, there are things we can do, and we are doing and will be doing over the next couple of days to try and address this. It's a reflection of how challenging it is for healthcare workers to feel very vulnerable, as we are, working in these situations, worrying about getting sick ourselves, worrying about passing it on to our families, our homes, but also being able to care for people effectively. And it's a challenge that we have 9 long-term care facility outbreaks where additional protections are needed in those facilities. And then we now have increasing numbers of people in hospital, and that is going through way more personal protective equipment than we expected. So we are on a tenuous level right now, but we do have a plan for that. We've had a plan for a number of months about how to address that, and there are things that we can do that we've seen being done in other places that are based on evidence around how we can cohort patients, for example, so people don't have to change their masks or respirators and eye protection between each patient, because you're dealing with everybody who has the same thing. So there are things that we will be doing over the coming days, and we can have more details once we've worked it out with the healthcare worker leaders and with our hospital leaders over the next 48 hours. We are also absolutely looking at all aspects of things that we can do to increase our stockpiles of personal protective equipment. Particularly, there's good evidence that you can reuse certain types of equipment if it's been cleaned appropriately, and we're looking at how we can do that. We're also looking at alternate supplies from around the world.
Great. Next question is from Ashley Wadwani from the Black Press. Go ahead, Ashley.
Hi, Dr. Bonnie Henry. Can you elaborate by any chance on the age of specifically the 26 people who are in intensive care right now, as well as the 64 others, or the 64 who are hospitalized?
I could, but I don't have that data with me, but I can certainly bring that tomorrow. There is an epidemic curve that is on the BC CDC website with an age curve as well. The majority of people who are hospitalized are, just doing it from memory, I know all of the deaths have occurred in people who are older than 70. The hospitalizations have been primarily in people who are over I'm just trying to think of it in my mind. I believe it was over 50. There has been one hospitalization in a person under the age of 10. There has most of the ICU cases as well are people who are over 60, but I don't have the exact details, but I can get that for tomorrow.
And our last question comes from Glenn Korstrom from Glacier Media. Go ahead, Glenn.
Hi, Dr. Henry. Can you hear me?
Yeah.
Hello?
Yep, we can hear you. Go ahead.
Okay. Ever since the first case at Lynn Valley Care Center, you were aware that many care home staff worked at multiple facilities. And then in the last week, you said that there was a policy that these workers would only work at one facility. And yesterday, you said that you weren't sure if the policy was in effect, but it would by the end of the week. And I'm just wondering what took so long? What were the glitches so that it didn't take effect right away?
Yeah, so it is complex. So it's not a policy, it's an order. So it's a provincial health officer order that looks at the whole long-term care, assisted living, and acute care sectors. And what we will do over the coming days is have a centralized assignment of people so that people work at one facility only. What is the challenge is over the last 20 years, there have been contracts and subcontracts for different types of workers in long-term, particularly in long-term care. So whether it's nurses or care aides or the food service people, the cleaning in those facilities, that has meant that there are many different types of contracts. There are many different types of facilities. Some are owned and operated by the health authority, some are private, and the types of subcontracts they have are myriad and complex. So it's not as simple as saying, okay, everybody, you just need to go to one facility only, because that would have left other facilities potentially with an extreme shortage. So it had to be managed in a centralized way. We have both particularly in the Lower Mainland, as you know, this is where where the facility outbreaks have been most intense. And the medical health officer, Dr. Patty Daly and Dr. Martin Lavoie in Fraser Health and Vancouver Coastal, respectively, they have put orders on the outbreak facilities so that people can only work in that facility once it's identified. So now we need to do that on a broader scale. As you can imagine, with some unionized, some non-unionized, the wage scales are different as well. So we are coming out with a provincial central strategy that provides a consistent approach to all facilities across the province, focusing on the Lower Mainland right now, and that it has been a very complex program. But it is starting. The outbreak facilities themselves are first and have started already, but we will be moving for all facilities within the coming days.
Great, and that's all the time we have for today. Thank you.
Thank you very much.